So before you go into the room, you would assemble your equipment, put on any PPE that you need, perform hand hygiene, foam in and out, and then you would knock and pause. Hi, I'm Haley. I'll be your nurse today. I'm going to do an assessment on you. It'll take about 5 minutes. Do you have any questions?
No.
Okay. So you would get their vitals right away. I don't have any vitals. And do you have any pain?
No.
Alright. So you would assess their level of consciousness. She's obviously awake. What's your name?
Stacy Hopke.
Your date of birth?
4/11/74.
Do you know where you're at?
My bedroom.
Do you know the date?
April 14th, 2020.
Yep. So you'd assess their mood. Obviously, she's in an acceptable, calm mood, not angry. You would assess their facial expressions. Obviously, if she's in pain, and she says she's not, but if you touch her and she winces. So you would start with their head, check their scalp. You would check their hygiene and odor as you're doing this as well. Check to see if they're clean, if there's any bumps on their head. There is not. So you would have her follow this 6 cardinal glazes. You would check Perla. Look inside her mouth. Good. Oral hygiene's good. You could check in their ears for drainage. Okay. Her nose. You make sure it's symmetrical, that and her ears. So when I came in, I forgot to say to check for safety in the room. You would clean up anything on the floor so they don't fall. Trace back equipment. As you can see, she has on an oxygen mask. So you would trace it back and see that it's not plugged in. So you'd want to plug it in. You don't need one. Just make sure everything's out of the way. If there was any guest in the room, you could ask them to leave if the patient wants them to. So next you would check their neck. See if there's any nodules that stick out. Look for jugular vein distension. Palpate the carotid arteries one at a time. Can you turn your neck? No pain?
Nope.
Okay. Next you would listen to the heart and lungs. You listen to the heart the full minute. I'm not going to save time. Take some deep breaths. Can you sit up for me? Her lung sounds were all clear. So you'd have them lay back a little bit. You could undrape them to listen to their stomach. You may have to listen up to 5 minutes to hear bowel sounds. Then you would palpate it and see if there's any tenderness or pain. If it's rigid, that's an emergency. So I'm going to undrape you now. You would feel all their pulses down their extremities. So like in her arms. And you would compare the radial and apical pulse. You do it on both sides. Can you squeeze my hand? Okay. Good range of motion in her hands. When you do the stomach, when was your last bowel movement?
This morning.
When did you last go to the bathroom?
30 minutes ago.
Any issues?
No.
If you had to, if they had a catheter, you would check their genitalia as needed. So as you move down, you would assess all the pulses in their legs. Assess for edema. Assess both. sap refill in the toes and in the fingers. See how the range of motion is in the feet. Do you have anything else for me?
I don't think so.
All right, thank you.
You're welcome. She should get extra credit